A very warm welcome from all of us in the Irish Cancer Society. My name is Dr. Robert O'Connor, and I'm the Director of Research for the Society. So we've been getting many questions from patients about diet and nutrition issues during the coronavirus emergency. So I'm delighted to be joined today by a real expert in the field, Ruth Kilcawley. Ruth is a senior nutritional support dietitian in oncology and hematology from University Hospital Galway, and Ruth has kindly agreed to give us some expert advice on these issues. Ruth, thanks so much for joining us today.
Thank you very much, Robert, for having me here today. I hope I can help you out.
I'm very confident that you will. So firstly, are there any take-home points that you'd like to emphasize about nutrition for those impacted by cancer at this difficult time?
Yes, firstly, I'd like to say that the dietary advice is the same. It's all about eating a healthy, balanced, varied diet. But what's different is that it's a little bit more challenging in this environment, mainly because of the limited access to shops, perhaps less choice in what foods we are eating. And I suppose just the psychological components of dealing with this change of how we behave and how we all live together. So that's going to impact on people's nutritional intake and their nutritional status. So they will be the main things that I think I should focus on today for you.
So one thing that confuses many of us is not just that cancer is not one single disease, but also the expert advice may be different through different parts of a cancer experience. So what are the major groups of people that we're aiming for with our nutritional advice?
Yeah, certainly. We tend to give different advice based on a lot of components that personalize the nutritional plan for patients. But in general, there's the standard population-based healthy eating advice, which really should be followed by people in the prevention of cancer. And it's very similar in survivorship as well. As I said, the very balanced, broad dietary intake with a wide range of fruit and vegetables, whole grain carbohydrates, lean dairy products, a good variety of protein foods, and a healthy fat intake with different types of fats. However, when you're going through cancer treatment, it can be a little bit different. The disease, the treatment, the stage of treatment somebody is at, all play a role in individualizing dietary advice. So, for example, we would not give the same dietary advice to somebody with esophageal cancer who's struggling with eating solid foods and maybe preparing for surgery, as we would give to maybe a patient with breast cancer who is going through treatment with minimal side effects. So the dietary advice for people going through treatment is very different than that before or after treatment.
So if someone was, say, after going through cancer treatment some years ago, maybe they're retired or that, and for example, someone who had been through breast cancer treatment or prostate cancer treatment, they may even be on some medication many years after that. What are the important things they should be looking out for in their diet during this COVID emergency?
So one of the biggest factors for people is the reduction in access to physical activity, our reduction in the amount of physical activity people are doing. And as we get older, there's a natural decline in muscle mass. And this is a very important consideration for people even years after cancer treatment, and particularly if they are on medication which can affect their body composition. And so it's very important for people to try and access exercise within the home, but also that their dietary intake contains adequate amount of protein at their meals and their snacks, so that they can preserve the muscle mass that they have. The dietary advice for people years after cancer treatment is very much around protecting those people against cancer recurrence and also protecting against chronic disease such as cardiovascular disease. So it's very important to follow healthy eating advice in order to minimize risk of development of those conditions again. So really up the proteins in meals and snacks. And it's very important to just follow the dietary advice that you need to maintain a healthy weight, limiting alcohol, and obviously other lifestyle factors like avoiding smoking is very important.
So, what would be the advice for someone who is perhaps currently going through cancer treatment, particularly chemotherapy treatment, and what should they be looking out for in themselves or loved ones who are going through that journey with someone?
Mm.
How could a loved
Mm.
one better support the nutritional needs of somebody going
Mm.
through active cancer treatment?
Mm. It's such an important question, Robert, because while at the moment we're in this very severe national lockdown phase, the reality for people going through treatment is um, they're going to have to really keep their kind of lockdown phase going for that bit longer if they're going through treatment. So asking about weight change is very important. So noting if there's been any unintentional weight loss, and also asking around appetite is very important. We know that people who are losing weight unintentionally and who have a reduction in their appetite are very much at risk of malnutrition, and malnutrition is an independent risk factor for reduced quality of life and I suppose impaired treatment tolerance as people go through treatment. So we monitor, and I would recommend that friends and family and even individuals monitor themselves for malnutrition risk by looking at their weight and their appetite. It's very important as well to monitor for other symptoms that can affect food intake. So, if somebody is feeling nauseous, if they have constipation or dry mouth, or feel full quickly when they eat, or if they suffer from any problems with their bowels like constipation or diarrhea, they will also affect the adequacy of the diet because it can be difficult to eat enough when those symptoms are going on. So, reaching out to their primary team in oncology, noting the symptoms and seeking treatment for them is very important. From a dietary perspective, going through treatment, the role of nutrition is around preserving lean mass during treatment and also avoiding nutritional deficiencies from inadequate intake. So, eating a diet that contains all of the components that I mentioned before, from point of view of fruit and vegetables, protein, but also focusing on perhaps increasing meal frequency if the portion sizes are small is important as well.
So, patients going through treatment could have lots of other symptoms that might impact their ability to
Mm,
eat normally. So, maybe changes in taste or sores in their
yeah,
mouths or
yeah.
fatigue. All of those things you're saying, are things that need to be kept an eye on and maybe reported on to the clinical team if there are problems. Would that be the case?
Oh, absolutely, yeah. Because while we wouldn't necessarily think that one thing like a change in taste is important on its own, if there are a number of background symptoms going on, so maybe reduced taste, maybe an issue with constipation, that will lead to a feeling of fullness, and those contributory factors can lead to unintentional weight loss. And the problem with unintentional weight loss during cancer treatment is that we know from evidence and from research that it's linked to I suppose not being able to tolerate treatment as well, maybe having to get dose reductions on chemotherapy. And generally, we know that people who don't maintain their weight tend to report more side effects. So it's kind of like a vicious circle. So being very vigilant around monitoring those side effects is important.
So, in terms of someone who has maybe recently been through treatment, so they're coming back, they're trying to get back into a normal life, maybe recovering from an operation or chemotherapy. Is there any
Mm.
advice that you would have for those people?
Yeah, certainly the first and most important thing is that, the healing and the recovery process takes time. And as much as we would like and feel we want to accelerate the healing process or want to boost our immunity, the most important thing really is to resist the urge to, I suppose, Google search for ways of accelerating that process. Follow the advice of your team around rest and recovery, and get the support that you need from friends and families to ensure that you have access to nourishing, high protein, regular meals and snacks. And so that's very important because the nourishing diet is very important for weeks after something like a surgical procedure. And indeed, depending on this procedure itself, depending on the procedure itself, the diet may have to change. So some people may need a modification to their diet, such as the texture needs to change for a couple of weeks. So following the advice of the team and rest and recovery in the post-operative period is very important. And for the diet to contain protein, so dairy products, meat, fish, chicken at meal times, and making sure that if the portions are small, that the frequency of eating is increased.
So we've all had to learn some new terms, and certainly one that is unfortunately common at the minute is cocooning, where people are essentially in complete isolation in their home, and it's much more isolating. And often people can become very distant then from neighbours and friends and so on. Thankfully, a lot of supports are being provided now. So volunteers, neighbours, family members may be giving food and so on. Are there any warning signs that they might be able to keep an eye out for as they're maybe bringing meals to loved ones or to people in their community that could maybe prompt a thought as to whether somebody might need to contact a GP or some other healthcare professional?
Yeah, I suppose it's something that is something that's on my mind a lot as a practitioner, in the sense that I'm blown away on a community level by the offers of support that my patients are telling me they're getting from their neighbours and from people in their community, the offer of meals, of shopping, and really we have a lot to be proud of in this country from a community perspective. But I suppose it's very important to remember that people going through cancer treatment are already very vulnerable, and so when we're providing them with food or we're providing them with essentials, it's important to check on things like, for example, targeting questions around, how did you get on with the dinner yesterday? Did you eat it all, or was it something that you liked, or did you manage half of the meal? Being, I suppose, a little bit alert to maybe infrequent requests for food. So, we can often put out the message, oh, just contact me when you need to go shopping. But if that request doesn't come, is that person getting the food that they need to stay healthy? Buying perishable foods, or foods that are not perishable, such as canned food and food that will do well in the freezer is important, so that there's easy access for people. And also checking in that brief contact that you may have with someone, looking for signs that they are healthy and well. So we'd be very concerned about people if we see obvious signs of weight loss, fatigue, if they're pale in colour, and if they're reporting that they're simply not hungry. They will be signs to alert us that there's maybe a problem with malnutrition.
So if somebody saw that in a loved one or someone that they're helping care, they might maybe contact the local public health nurse or maybe a GP or something and try and follow up, as well as perhaps with the person themselves who may not notice these changes in their bodies. Would that be the case?
Yeah, I think the first thing is always to try and have that conversation with the person themselves, obviously, maybe over the phone later in the day. Maybe it's the case of, I noticed you weren't your normal self. How are you getting on? And having those conversations and urging the person to contact their team or contact their GP if they're feeling unwell. And also just that repeated check-in over, how are you finding the food that I'm bringing you? Do you like it? Does it suit you? How are you getting on maybe with the nourishing drinks? Just those simple questions can go a long way to helping someone see if they're struggling with their diet.
So at stressful times like this, it's very easy to go off and maybe think that there might be special diets or magic diets, particularly if someone's worried about coronavirus, and there have been lots of claims on the internet, etc., about various things. What's your view on these, maybe superfoods or immune boosters, etc.?
So it's simply not possible to boost an already fully functional immune system. And I suppose to maintain that very strong immune system, what we do know is that it's important to avoid energy deficiency. So don't eat less than your body needs, because this can impair the proper functioning of all the systems in the body, your digestive system, your immune system, hormonal system, etc. And so it's important to be meeting your energy requirements, because to eat less than you need for a sustained period of time puts you at increased risk of infection. Similarly, it's important to ensure you're not deficient in vitamins and minerals. So many vitamin and mineral deficiency syndromes can have an impact on your ability to fight infections. And so they would be the two biggest recommendations in maintaining a healthy immune system. The problem is that those issues can be addressed through eating a varied, nutritious, nourishing diet. But if you are struggling to eat in this way because of your condition, it's important to raise those issues with your GP, public health nurse, or your treating team, because they can assess you for the presence of a deficiency through a blood test, for example. And if required, your dietitian or your doctor can commence you on a medically supervised supplementation plan in the form of nourishing drinks, or say specialist treatment with individual minerals, such as treating iron deficiency or providing vitamin D. But we do urge that is done on the basis of a diagnosis of a deficiency, because those steps are not been proven to improve immune function in people who already have a perfectly well functioning immune system.
So to wrap up, are there any take-home points that you'd like to really stress to those impacted by cancer in these extraordinary times?
Yeah, so what I hope from our little chat today, that people will maybe take with them, is, first of all, that any change impacts on dietary intake, and this current COVID-19 crisis we're going through, it changes the access to food. It changes the choice of food that you may like, and it often changes the frequency of food intake. It's really important for carers and for loved ones to be alert to the risk of malnutrition in people who are going through cancer treatment, through focusing on checking for unintentional weight loss and reduction in appetite. It's important to remember that a proper functioning immune system can't be boosted, but inadequate dietary intake can increase the risk of infection. So it's important to be alert to possible deficiencies if you're struggling with intake. And also, that nutritional needs are very different for people depending on where they are on their cancer journey. And so it's always important to seek the right advice from your dietitian, treating oncologist, or in survivorship from your GP.
Ruth, thanks so much for that insight. As always, it's been hugely useful. Very grateful to you. Keep safe and talk to you again soon.
Thank you, Robert. Same to you.